Question 1. Process analysis reveals that a newly introduced foraging enrichment device for a group of primates has been placed in their enclosure. The care team observes that the primates do interact with the device, manipulating it to release food rewards. However, the team is unsure if this interaction is truly beneficial for their welfare. Which of the following approaches best evaluates the effectiveness of this enrichment? Option A. Focus on whether the primates appear excited or agitated when the foraging device is presented, as this indicates engagement. Option B. Systematically observe and record changes in the primates' activity budgets, social interactions, and stereotypic behaviors before and after the introduction of the foraging device, looking for increased exploration and reduced signs of stress. Option C. Assume the enrichment is effective because the primates are actively engaging with the device and receiving food rewards. Option D. Monitor the device for signs of damage or wear, indicating that the primates are interacting with it frequently. Correct answer is B. Systematically observe and record changes in the primates' activity budgets, social interactions, and stereotypic behaviors before and after the introduction of the foraging device, looking for increased exploration and reduced signs of stress. Explanation. This scenario presents a common challenge in animal care, ensuring that enrichment activities are not only provided, but are also genuinely effective in promoting the animal's welfare. The professional challenge lies in moving beyond simply observing the presence of enrichment items to actively evaluating their impact on the animal's behavior and psychological state. This requires a nuanced understanding of animal behavior and the ability to interpret subtle cues. Careful judgment is required to distinguish between superficial engagement and genuine benefit. The correct approach represents best professional practice because it directly addresses the core principle of animal welfare, ensuring that interventions are beneficial. By systematically observing and recording specific behavioral indicators, an animal care provider can gather objective data to assess whether the enrichment is reducing stress, promoting natural behaviors, and enhancing the animal's overall quality of life. This aligns with the ethical obligation to provide care that is demonstrably in the animal's best interest, as often stipulated in animal welfare legislation and professional codes of conduct that emphasize evidence-based care and continuous improvement. An incorrect approach that relies solely on the animal interacting with the enrichment item without further observation fails to meet professional standards. This is because interaction does not automatically equate to effectiveness. An animal might interact with an item out of boredom, curiosity, or even frustration, without experiencing any positive welfare outcome. This approach risks providing enrichment that is merely a token gesture, failing to address underlying welfare needs, and potentially masking signs of distress or suboptimal conditions. This constitutes an ethical failure to actively promote welfare and a regulatory failure to demonstrate due diligence in care provision. Another incorrect approach, focusing only on the novelty of the enrichment, is also professionally unacceptable. While novelty can initially stimulate interest, its effectiveness wanes over time. A professional assessment must consider the long-term impact and the animal's sustained engagement and benefit. Relying solely on novelty overlooks the need for varied and appropriate enrichment that caters to the animal's species-specific needs and individual preferences over time. This is an ethical lapse in understanding the dynamic nature of enrichment and a regulatory oversight in failing to implement a comprehensive welfare strategy. A further incorrect approach, assuming enrichment is effective if the animal is not exhibiting overt signs of distress, is insufficient. The absence of overt distress does not equate to optimal welfare. Animals can experience subclinical stress or a lack of positive engagement without displaying obvious negative behaviors. Professional practice demands proactive assessment for positive indicators of welfare, such as engagement in species-typical behaviors, exploration, and signs of contentment, rather than passively waiting for negative signs to appear. This represents an ethical failure to strive for the highest possible welfare standards and a regulatory failure to implement a proactive and comprehensive welfare monitoring program. The professional decision-making process for similar situations should involve a cyclical approach. 1. Identify species-specific and individual animal needs for enrichment. 2. Select and introduce appropriate enrichment items or activities. 3. Systematically observe and record relevant behavioral data before, during, and after enrichment provision. 4. Analyze the data to evaluate effectiveness, looking for changes in behavior that indicate reduced stress, increased engagement, and promotion of natural behaviors. 5. Adjust or modify enrichment strategies based on the evaluation to ensure ongoing effectiveness and to meet evolving needs. This iterative process ensures that enrichment is a dynamic and responsive component of animal care. Question 2. The performance metrics show a higher incidence of stereotypic behaviors in a group of rabbits housed in an enriched environment compared to a control group in a less enriched environment. Which of the following approaches best addresses this discrepancy in animal welfare? Option A. Conduct a detailed behavioral ethogram analysis for both groups, investigate potential social stressors within the enriched group, and assess the adequacy of the specific enrichment items provided in meeting the rabbit's species-specific behavioral needs. Option B. Attribute the increased stereotypic behaviors to individual animal temperament and monitor the situation without further intervention, assuming the enrichment is otherwise beneficial. Option C. Focus solely on the physical dimensions of the housing, assuming that if the space is adequate, the observed behaviors are not a welfare concern. Option D. Conclude that the enrichment is causing stress and immediately remove all enrichment items from the affected group to reduce behavioral anomalies. The correct answer is A. Conduct a detailed behavioral ethogram analysis for both groups, investigate potential social stressors within the enriched group, and assess the adequacy of the specific enrichment items provided in meeting the rabbit's species-specific behavioral needs. Explanation. The performance metrics show a disparity in the observed stress behaviors between two groups of animals housed in similar environments. This scenario is professionally challenging because it requires a nuanced understanding of animal behavior and welfare, moving beyond simple observation to interpret subtle indicators and potential underlying causes. It demands careful judgment to differentiate between normal species-specific behaviors and those indicative of distress or poor welfare, especially when environmental conditions appear consistent. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based assessment of animal welfare. It involves a systematic investigation that considers multiple contributing factors to behavior, including environmental enrichment, social dynamics, and individual animal history. This aligns with the core principles of animal care, emphasizing the prevention of suffering and the promotion of positive welfare, as mandated by regulatory frameworks that require providers to ensure animals are kept in conditions that meet their physical and behavioral needs. An incorrect approach that focuses solely on the physical environment without considering behavioral indicators fails to meet regulatory requirements for comprehensive welfare assessment. It overlooks the fact that behavioral changes are often the earliest and most sensitive indicators of stress or discomfort. Another incorrect approach that dismisses observed behaviors as simply individual variation, without further investigation, is ethically problematic and potentially in violation of guidelines that require proactive identification and mitigation of welfare concerns. It abdicates responsibility for understanding and addressing potential suffering. Third incorrect approach that relies on anecdotal evidence or personal opinion rather than objective observation and established behavioral science principles lacks the rigor necessary for professional animal care and can lead to misdiagnosis and inappropriate interventions, potentially contravening standards of care. Professionals should employ a decision-making framework that begins with objective observation and data collection. This should be followed by a comparative analysis, considering both interspecies norms and the specific context of the animal's environment and history. When welfare concerns are identified, a systematic investigation into potential causes, including environmental, social, and health factors, is crucial. Interventions should be evidence-based and regularly evaluated for effectiveness, with a continuous feedback loop to ensure ongoing welfare improvement. Question 3. The monitoring system demonstrates a rabbit exhibiting rapid breathing and a hunched posture. Which of the following communication interpretations is most aligned with best practices for animal care providers? Option A. The rabbit is likely excited and preparing to play, as rapid breathing is a sign of increased energy. Option B. The rabbit is exhibiting typical resting behavior for its species, indicating no immediate concern. Option C. The rabbit is likely experiencing pain or stress, requiring immediate assessment for underlying causes and potential intervention. Option D. The rabbit is communicating a need for more social interaction, as hunched posture can indicate loneliness. Correct answer is C. The rabbit is likely experiencing pain or stress, requiring immediate assessment for underlying causes and potential intervention. Explanation: this scenario presents a professional challenge because accurately interpreting animal communication is crucial for their welfare and safety, yet it requires specialized knowledge and careful observation. Misinterpreting signals can lead to delayed intervention, inappropriate care, or even harm to the animal. The challenge is amplified by the diversity of species and their unique communication methods, necessitating a nuanced approach rather than a one-size-fits-all solution. The correct approach represents best professional practice because it prioritizes species-specific understanding and utilizes multiple sensory inputs for a comprehensive assessment. This aligns with the ethical obligation to provide care that respects the individual needs and natural behaviors of each animal, as mandated by animal welfare regulations that emphasize understanding and responding to animal signals. Relying on a broad, generalized interpretation of distress signals across all species is insufficient and potentially harmful. An incorrect approach that relies solely on vocalizations for all species fails to acknowledge that many animals communicate primarily through body language, scent, or subtle physiological changes. This oversight constitutes a regulatory failure by not adhering to the standard of care that requires a thorough understanding of species-specific communication, potentially leading to neglect of an animal's distress if it is not vocalizing. Another incorrect approach that assumes all mammals communicate distress similarly ignores the vast differences in social structures, sensory perception, and behavioral repertoires even within mammalian orders, leading to misinterpretations and inadequate responses. This is an ethical failure, as it demonstrates a lack of due diligence in understanding the specific needs of the animal under care. Professionals should employ a decision-making process that begins with identifying the species and researching its known communication methods. This involves consulting reliable resources, observing the animal's baseline behavior, and then interpreting observed signals within the context of that species' typical repertoire. When assessing distress, professionals should integrate observations of vocalizations, body posture, facial expressions, tail movements, ear position, and any other relevant behavioral cues. If uncertainty remains, seeking advice from experienced colleagues or consulting veterinary professionals is a critical step in ensuring appropriate and timely intervention. Question 4. Operational review demonstrates that a resident dog in the facility has developed a persistent cough and lethargy. The attending veterinarian recommends a diagnostic workup and potential treatment, estimating the cost to be significant. The facility manager is concerned about the budget and suggests waiting to see if the symptoms resolve on their own, or, alternatively, seeking the least expensive veterinary option available, even if it means traveling to a clinic further away. As the certified animal care provider responsible for the daily well-being of the animals, what is the most ethically sound and professionally responsible course of action? Option A. Postpone veterinary intervention and monitor the dog's condition, hoping the symptoms will naturally improve to avoid immediate expenditure. Option B. Consult with other animal care providers to gather opinions on less expensive, alternative treatments that might be effective without a full diagnostic workup. Option C. Advocate for the recommended diagnostic workup and treatment, exploring options for financial assistance or phased payment plans if necessary, to ensure the dog receives timely and appropriate care. Option D. Immediately seek the cheapest veterinary service available, prioritizing cost over the veterinarian's proximity or specialized expertise to minimize immediate financial outlay. The correct answer is C. Advocate for the recommended diagnostic workup and treatment, exploring options for financial assistance or phased payment plans if necessary, to ensure the dog receives timely and appropriate care. Explanation: this scenario presents a professional challenge due to the inherent conflict between the immediate financial interests of the facility and the long-term welfare and ethical treatment of the animals. The decision requires balancing resource allocation with the moral obligation to provide a high standard of care, even when it incurs additional costs. Careful judgment is required to ensure that decisions are not solely driven by economic factors, but are grounded in ethical principles and regulatory compliance. The correct approach prioritizes the animal's well-being and adheres to the ethical duty of care, which is a cornerstone of animal welfare regulations. This approach recognizes that preventative care, even if costly upfront, is often more humane and ultimately more cost-effective than treating advanced illness or suffering. It aligns with the principle of do no harm and the responsibility to provide an environment that meets the physical and psychological needs of the animals. This reflects best professional practice by demonstrating a commitment to the highest standards of animal care, which is often implicitly or explicitly mandated by the Animal Care Provider Certification Framework. An incorrect approach that focuses solely on immediate cost savings by delaying necessary veterinary intervention is ethically unacceptable. This fails to uphold the duty of care and can lead to unnecessary animal suffering, which is a direct violation of ethical principles and likely contravenes specific provisions within animal welfare legislation that mandate timely and appropriate veterinary care. Such an approach prioritizes financial gain over animal welfare, demonstrating a disregard for the core responsibilities of an animal care provider. Another incorrect approach that involves seeking the cheapest available veterinary service without considering the quality of care or the veterinarian's expertise is also professionally unsound. While cost is a factor, it should not be the sole determinant when animal health is at stake. This approach risks compromising the quality of care, potentially leading to misdiagnosis, inadequate treatment, and prolonged suffering for the animal. It fails to meet the standard of care expected of a certified animal care provider, which includes ensuring that all veterinary services are appropriate and effective. The professional decision-making process for similar situations should involve a systematic evaluation of the animal's needs, the available resources, and the ethical and regulatory obligations. This includes consulting with veterinary professionals to understand the best course of action for the animal's health and welfare. When faced with financial constraints, professionals should explore all available options for funding or cost-effective solutions that do not compromise the quality of care. Transparency with stakeholders regarding the animal's needs and the associated costs is also crucial. The ultimate decision must always prioritize the animal's well-being, guided by ethical principles and regulatory requirements. Question 5. The control framework reveals that an animal care provider is conducting a risk assessment for a new boarding facility. Which of the following approaches best aligns with the 5 freedoms of animal welfare and regulatory requirements for ensuring animal well-being? Option A. Prioritizing the assessment of potential risks to the freedom from hunger and thirst by ensuring readily available food and water, and evaluating the freedom from discomfort by assessing the adequacy of shelter and resting areas, while also considering the freedom from pain, injury, or disease through routine health checks and prompt veterinary intervention. Option B. Emphasizing the freedom from hunger and thirst and the freedom from discomfort by ensuring basic provision of food, water, and shelter, while deferring comprehensive assessments of behavioral needs and freedom from fear to a later stage once the facility is fully operational. Option C. Focusing primarily on the freedom to express normal behavior by providing ample space for exercise, and the freedom from fear and distress by ensuring a calm and quiet environment, as these are often the most challenging to manage in a group setting. Option D. Conducting a superficial review of the facility's layout and staffing levels, assuming that if animals appear outwardly calm, their welfare needs are being met, and only addressing issues if they become immediately apparent. The correct answer is A. Prioritizing the assessment of potential risks to the freedom from hunger and thirst by ensuring readily available food and water, and evaluating the freedom from discomfort by assessing the adequacy of shelter and resting areas, while also considering the freedom from pain, injury, or disease through routine health checks and prompt veterinary intervention. Explanation. The control framework reveals that an animal care provider is responsible for ensuring the welfare of animals under their care, which is directly governed by the principles of the 5 freedoms. This scenario is professionally challenging because it requires the provider to balance operational efficiency and cost-effectiveness with the absolute ethical and regulatory imperative to uphold animal welfare standards. The risk assessment must proactively identify potential threats to each of the 5 freedoms and implement robust mitigation strategies. The correct approach represents best professional practice because it systematically addresses each of the 5 freedoms, demonstrating a comprehensive understanding of the regulatory framework and ethical obligations. Specifically, it prioritizes the prevention of harm and the provision of appropriate care, aligning with the core tenets of animal welfare legislation and professional codes of conduct. This proactive and holistic assessment ensures that potential welfare deficits are identified and addressed before they manifest as actual suffering, thereby fulfilling the provider's duty of care. An incorrect approach that focuses solely on immediate observable signs of distress without considering the underlying causes or preventative measures fails to meet the regulatory standard. This is because it is reactive rather than proactive and may miss subtle but significant welfare compromises. For example, only addressing a visible injury without assessing the housing conditions that may have caused it is a regulatory and ethical failure. Another incorrect approach might prioritize cost savings over the provision of adequate enrichment or veterinary care, which directly violates the freedom from pain, injury, or disease and the freedom to express normal behavior. Such an approach demonstrates a disregard for the animal's intrinsic needs and a failure to comply with the spirit and letter of animal welfare laws. Professionals should employ a risk assessment framework that systematically evaluates potential threats to each of the 5 freedoms. This involves identifying hazards, assessing the likelihood and severity of harm, and implementing control measures. The process should be documented, regularly reviewed, and updated based on new information or changes in the animal's condition or environment. This structured approach ensures that all aspects of animal welfare are considered and that decisions are evidence-based and ethically sound, aligning with regulatory expectations and professional standards. Question 6. The assessment process reveals a domestic cat housed in a quiet, clean enclosure is consistently hiding under its bedding whenever a new person enters the room. The animal care provider needs to determine the most appropriate course of action to ensure the cat's welfare and facilitate its eventual adaptation. Which of the following ethological considerations is most critical for guiding the provider's response? Option A. Assuming the cat is being stubborn and requires firm handling to overcome its reluctance to interact, thereby establishing dominance. Option B. Concluding that the hiding behavior is a sign of illness and requires immediate veterinary intervention without further behavioral assessment. Option C. Believing that the cat is simply seeking attention and should be coaxed out with treats to encourage immediate socialization. Option D. Recognizing that hiding is a natural defensive behavior in cats, indicating a need for gradual, non-threatening introductions and environmental enrichment that provides safe refuges. The correct answer is D. Recognizing that hiding is a natural defensive behavior in cats, indicating a need for gradual, non-threatening introductions and environmental enrichment that provides safe refuges. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to interpret subtle behavioral cues and apply ethological principles to a practical care situation. Misinterpreting these cues can lead to suboptimal welfare, stress, or even harm to the animal, and can also result in regulatory noncompliance if care standards are not met. The provider must balance immediate needs with a deeper understanding of the animal's natural behaviors and motivations. Correct approach analysis. Understanding ethology is crucial because it provides the scientific basis for interpreting animal behavior. By recognizing that the cat's hiding behavior is a natural response to perceived threat or stress, rather than simple defiance, the provider can implement strategies that address the underlying cause. This approach aligns with the animal care provider certification's emphasis on promoting animal welfare through informed care practices. Regulatory frameworks for animal care often mandate providing an environment that minimizes stress and allows for natural behaviors, which is directly supported by ethological knowledge. Incorrect approaches analysis. One incorrect approach would be to force interaction or remove the animal from its hiding place without considering the ethological context. This disregards the animal's natural instinct for self-preservation and can escalate fear and stress, potentially leading to defensive aggression. This fails to meet the ethical obligation to minimize harm and stress, and may violate regulations requiring appropriate housing and handling that respects an animal's behavioral needs. Another incorrect approach would be to assume the animal is simply being difficult or attention-seeking. This anthropomorphic interpretation ignores the scientific understanding of animal behavior and can lead to inappropriate interventions. Ethology teaches that behaviors have evolutionary and functional significance. Attributing human-like motivations without evidence is a failure of professional judgment, and can result in care that is detrimental to the animal's well-being, potentially contravening standards that require understanding and responding to an animal's species-specific needs. A third incorrect approach might be to ignore the behavior altogether, assuming it will resolve on its own. While some behaviors are transient, persistent avoidance can indicate ongoing stress or an unmet need. Ethological observation requires proactive assessment and intervention when necessary. Ignoring the behavior can lead to chronic stress, which has significant negative impacts on an animal's health and welfare, and could be seen as a failure to provide adequate care as mandated by certification standards. Professional reasoning. Professionals should approach such situations by first observing the animal's behavior in its environment without immediate intervention. They should then consult their knowledge of ethology to hypothesize the cause of the behavior, considering species-specific natural behaviors, social dynamics, and environmental factors. Based on this ethological understanding, they should develop and implement a plan that addresses the likely cause, prioritizing the animal's welfare and minimizing stress. This involves a continuous cycle of observation, assessment, intervention, and reevaluation, always grounded in scientific principles of animal behavior and regulatory requirements for humane care. Question 7. Market research demonstrates that owners are increasingly concerned about the cost of veterinary care for their pets. You are presented with a dog exhibiting symptoms consistent with a moderate gastrointestinal upset, potentially requiring diagnostic tests and a specific dietary regimen. The owner expresses significant financial anxiety and asks for the most cost-effective way to manage the situation, stating they can only afford basic symptomatic relief. What is the most appropriate course of action for an animal care provider in this situation? Option A. Clearly explain the potential causes and the recommended diagnostic steps and treatment plan, including the benefits of each. Then, present a tiered approach to management, offering options that range from comprehensive diagnostics and treatment to more conservative symptomatic relief, while emphasizing the potential risks and benefits of each choice and working collaboratively with the owner to find a feasible plan. Option B. Provide a diagnosis and a list of potential treatments, but refuse to discuss financial concerns or offer any alternative management strategies, stating that the owner must find a way to afford the prescribed care. Option C. Advise the owner that the most cost-effective solution is to provide only basic symptomatic relief, such as over-the-counter antacids, and to monitor the situation without further diagnostic investigation, as the animal may recover on its own. Option D. Insist on performing all recommended diagnostic tests and initiating the most aggressive treatment protocol immediately, regardless of the owner's stated financial limitations, as the animal's health is paramount. The correct answer is A. Clearly explain the potential causes and the recommended diagnostic steps and treatment plan, including the benefits of each. Then, present a tiered approach to management, offering options that range from comprehensive diagnostics and treatment to more conservative symptomatic relief, while emphasizing the potential risks and benefits of each choice and working collaboratively with the owner to find a feasible plan. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the animal care provider to balance the immediate needs of an animal with the owner's financial constraints and potential misunderstanding of the severity of the condition. The provider must act ethically and competently while respecting the owner's autonomy and financial limitations, all within the established regulatory framework for animal care. The core tension lies in ensuring the animal receives appropriate care without overstepping professional boundaries or causing undue financial hardship. Correct approach analysis. The correct approach prioritizes the animal's welfare by clearly communicating the diagnosis and recommended treatment plan, including potential consequences of inaction. It then offers a tiered approach to management, presenting options that range from immediate, comprehensive care to more conservative, symptom management strategies, acknowledging the owner's financial concerns. This aligns with the ethical duty of care to the animal and the professional responsibility to educate the owner. It also respects the owner's decision-making capacity by providing clear, actionable information and alternatives. Regulatory frameworks for animal care providers typically mandate a duty of care, requiring providers to act in the best interest of the animal and to communicate effectively with owners. Offering a range of management options, from ideal to more accessible, demonstrates a commitment to both the animal's health and the owner's circumstances, reflecting best professional practice. Incorrect approach is analysis. One incorrect approach involves immediately insisting on the most expensive treatment without fully exploring the owner's financial situation or offering alternatives. This fails to acknowledge the owner's financial realities and could be perceived as prioritizing profit over the animal's well-being or the owner's ability to comply. Ethically, it can alienate the owner and lead to the animal not receiving any care if the owner cannot afford the sole option presented. It may also violate guidelines that encourage collaborative care planning. Another incorrect approach is to downplay the severity of the digestive disorder and recommend only minimal, inexpensive interventions, even if these are unlikely to resolve the issue or prevent complications. This constitutes a failure in the duty of care to the animal, as it does not provide adequate treatment for a diagnosed condition. It also fails to meet the professional obligation to inform the owner of the potential risks and progression of the illness, which could lead to more severe and costly problems later. This approach could be seen as negligent and a breach of professional standards. A third incorrect approach is to provide a diagnosis and treatment plan, but then refuse to discuss financial concerns or offer any flexibility, stating that the provider's job is only to diagnose and prescribe. This demonstrates a lack of empathy and a failure to engage in holistic client communication, which is crucial for successful animal care. While the provider's primary responsibility is to the animal, effective care often requires owner compliance, which is influenced by their understanding and financial capacity. This rigid stance can lead to poor outcomes for the animal and damage the professional relationship. Professional reasoning. Professionals should approach such situations by first establishing a clear diagnosis and understanding the prognosis. They should then engage in open and empathetic communication with the owner, actively listening to their concerns, including financial limitations. The provider should present a range of treatment options, clearly outlining the benefits, risks, and costs associated with each. This allows the owner to make an informed decision that aligns with their resources and their commitment to the animal's care. The decision-making process should involve a collaborative approach, aiming for the best possible outcome for the animal within the owner's practical constraints, always guided by the principle of animal welfare and adherence to professional ethical codes and regulatory requirements. Question 8. The efficiency study reveals that a domestic cat and a domestic dog, both housed in similar environments, exhibit different responses to enrichment activities. Considering the fundamental differences in their skeletal structures, which of the following approaches best explains the observed variations in their engagement and physical capabilities during these activities? Option A. Both animals have similar skeletal structures due to their shared mammalian classification, and their differing responses are primarily due to individual personality variations. Option B. The dog's longer limbs, a common skeletal feature in many breeds, enable it to perform more complex acrobatic feats than the cat. Option C. The cat's smaller bone density compared to the dog's is the sole determinant of its agility and engagement with enrichment activities. Option D. The cat's more flexible spine and less rigidly attached clavicle allow for greater agility in climbing, while the dog's more robust and rigid skeletal structure is adapted for endurance and running. Correct answer is D. The cat's more flexible spine and less rigidly attached clavicle allow for greater agility in climbing, while the dog's more robust and rigid skeletal structure is adapted for endurance and running. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to apply knowledge of comparative anatomy to a practical situation involving animal welfare and potentially differing care needs. Misinterpreting skeletal differences could lead to inappropriate handling, housing, or exercise recommendations, impacting the animal's health and safety. The provider must make a judgment call based on observed characteristics and their understanding of species-specific anatomy, necessitating careful consideration of potential risks. Correct approach analysis. The correct approach involves recognizing that, while both animals are mammals, significant skeletal differences exist between a domestic cat and a domestic dog. Cats possess a more flexible spine and a clavicle that is not fully attached to the shoulder blade, allowing for greater agility and the ability to squeeze through narrow spaces. Dogs, in contrast, have a more rigid skeletal structure adapted for endurance running and a more robust build. Understanding these differences is crucial for providing species-appropriate care, such as selecting suitable enrichment activities, ensuring safe enclosure designs, and advising on appropriate physical handling techniques to prevent injury. This aligns with the ethical obligation of an animal care provider to understand and cater to the unique biological needs of each species under their care, as implicitly required by general animal welfare principles and the need for competent care. Incorrect approaches analysis. One incorrect approach would be to assume that because both are common domestic mammals, their skeletal structures are functionally similar enough to warrant identical care protocols. This ignores fundamental anatomical variations that dictate different physical capabilities and vulnerabilities. Ethically, this represents a failure to provide individualized care and a potential breach of the duty of care, as it could lead to practices that are detrimental to one species. Regulatory failure lies in not meeting the implicit standard of competent care that requires understanding species-specific needs. Another incorrect approach would be to focus solely on superficial similarities, such as fur color or size, without considering the underlying skeletal differences. This superficial assessment can lead to misjudgments about an animal's physical limitations or strengths. For example, assuming a smaller dog breed has the same skeletal flexibility as a cat could lead to recommending activities that are too strenuous or pose a risk of injury. This is a regulatory failure, as it demonstrates a lack of the necessary knowledge and skill expected of a certified animal care provider. A third incorrect approach would be to apply generalized mammal care guidelines, without acknowledging the distinct evolutionary adaptations in skeletal structure between carnivores like cats and canids like dogs. While both are mammals, their predatory and locomotive adaptations have resulted in significant skeletal divergences. Failing to account for these divergences can lead to inappropriate exercise regimes or housing that does not accommodate their specific biomechanical needs, potentially causing stress or physical harm. This is an ethical failure to provide specialized care and a regulatory failure to demonstrate species-specific competency. Professional reasoning. Professionals should employ a decision-making framework that begins with species identification, followed by recalling or researching known anatomical and physiological differences relevant to care. This involves considering how skeletal structure influences mobility, susceptibility to injury, and behavioral needs. When faced with a scenario involving different species, the provider must actively seek to understand these distinctions, rather than relying on generalizations. This proactive approach ensures that care is tailored, safe, and ethically sound, meeting both regulatory expectations and the welfare needs of the animals. Question 9. The audit findings indicate that the facility's air quality may be compromised, potentially affecting the health and well-being of the animals. Which of the following strategies best addresses this concern in accordance with best practices for animal care providers? Option A. Reducing the number of animals housed in each enclosure to decrease internal air pollutant generation. Option B. Relying on staff observations of animal behavior to gauge air quality improvements. Option C. Increasing the frequency of room deodorizing treatments to mask any unpleasant smells. Option D. Implementing a comprehensive ventilation system upgrade and regular monitoring of key air quality parameters such as ammonia, carbon dioxide, and particulate matter. The correct answer is D. Implementing a comprehensive ventilation system upgrade and regular monitoring of key air quality parameters such as ammonia, carbon dioxide, and particulate matter. Explanation. The audit findings indicate a potential lapse in maintaining optimal air quality within the animal care facility. This scenario is professionally challenging because air quality directly impacts animal health, welfare, and the overall safety of the environment for both animals and staff. Ensuring adequate ventilation, appropriate temperature and humidity, and minimizing airborne contaminants requires a comprehensive understanding of animal physiology, environmental science, and relevant regulations. Careful judgment is required to identify the most effective and compliant strategies for improvement. The correct approach represents best professional practice because it prioritizes a multifaceted, evidence-based strategy that addresses the root causes of poor air quality. This involves a systematic review of ventilation systems, consideration of environmental factors, and implementation of preventative measures. Such an approach aligns with the core principles of animal welfare and the regulatory framework for animal care providers, which mandates the provision of a healthy and safe environment. It demonstrates a commitment to proactive management and continuous improvement in animal care standards. An incorrect approach that focuses solely on masking odors fails to address the underlying issues affecting air quality. This is a regulatory and ethical failure because it does not improve the actual air composition, which may still contain harmful pathogens, allergens, or irritants. It is a superficial solution that neglects the health and well-being of the animals and staff. Another incorrect approach that relies on anecdotal evidence or personal opinion rather than scientific data or established best practices is also a failure. This can lead to ineffective or even detrimental interventions, violating the duty of care owed to the animals and potentially contravening regulatory requirements for evidence-based practice. A third incorrect approach that prioritizes cost-saving measures over the efficacy of air quality improvement demonstrates a disregard for animal welfare and regulatory compliance. This can result in a substandard environment that compromises animal health and safety, leading to potential penalties and reputational damage. Professionals should employ a decision-making framework that begins with a thorough assessment of the current situation, referencing relevant regulations and scientific literature. This should be followed by the identification of potential solutions, evaluating each for its effectiveness, feasibility, and compliance. Prioritizing interventions that address the root causes and offer long-term benefits for animal welfare and environmental quality is crucial. Continuous monitoring and evaluation of implemented strategies are essential to ensure ongoing compliance and optimal air quality. Question 10. Governance review demonstrates that when assessing the digestive system of animals under care for optimal dietary management, a critical comparative analysis point is identifying the primary mechanism for breaking down plant matter. Which of the following digestive system characteristics is most crucial for differentiating dietary needs between a grazing herbivore and a carnivore? Option A. The presence of a gizzard for mechanical grinding of food. Option B. The relative length of the small intestine. Option C. The presence and function of a rumen or large cecum for microbial fermentation. Option D. The presence of a gall bladder for bile storage. The correct answer is C. The presence and function of a rumen or large cecum for microbial fermentation. Explanation. Scenario analysis. This scenario presents a challenge in applying general principles of digestive system health to specific species under care, requiring a nuanced understanding of species-specific physiology and dietary needs. The professional must discern which digestive system characteristic is most critical for a particular animal's well-being and dietary management, moving beyond a one-size-fits-all approach. This demands a deep understanding of comparative anatomy and physiology, as well as the regulatory framework governing animal care, which emphasizes species-appropriate husbandry. Correct approach analysis. The correct approach focuses on the fundamental difference in how herbivores and carnivores process food, specifically the role of microbial fermentation in herbivores. This is crucial because it dictates dietary requirements, potential digestive issues like bloat or colic, and the types of feed that can be safely and effectively utilized. Adhering to this principle aligns with regulatory guidelines that mandate providing nutrition suitable for the animal's species and digestive capabilities, ensuring optimal health and preventing distress. Incorrect approaches analysis. One incorrect approach might focus on the presence of a gizzard, which is primarily found in birds and some reptiles, not mammals commonly cared for by providers. This would be a regulatory failure as it misapplies anatomical knowledge to an inappropriate species group, leading to incorrect dietary recommendations and potentially harmful husbandry practices. Another incorrect approach could highlight the presence of a gall bladder, which is common to many vertebrates, including both herbivores and carnivores. While important for digestion, its presence alone doesn't differentiate the core digestive strategies that are paramount for species-specific dietary management, and thus would not be the most critical factor for comparative analysis in this context. A third incorrect approach might emphasize the length of the small intestine, which varies between species, but is not the primary determinant of how food is broken down and absorbed in the same way that fermentation or enzymatic digestion is. Focusing solely on length, without considering the digestive processes occurring within those sections, would lead to an incomplete and potentially flawed understanding of dietary needs. Professional reasoning. Professionals should approach comparative digestive system analysis by first identifying the animal's primary feeding strategy, herbivore, carnivore, omnivore. Then they should consider the key physiological adaptations that support this strategy, such as the presence and function of specialized digestive organs, e.g., rumen, cecum, or unique enzymatic capabilities. This systematic approach, grounded in species-specific knowledge and regulatory requirements for appropriate care, allows for accurate dietary planning and the prevention of digestive disorders. Question 11. The assessment process reveals that a dog in your care, a senior Labrador, has begun to show subtle signs of reluctance to jump onto its favorite resting spot and occasionally exhibits a slight stiffness when rising after periods of rest. You have observed these changes over the past 2 weeks. Considering the structure and function of bones, which of the following actions best demonstrates responsible animal care in this situation? Option A. Monitor the dog closely for several more weeks to see if the stiffness resolves on its own, as it might be a temporary issue. Option B. Administer over-the-counter joint supplements without consulting a veterinarian, based on anecdotal evidence from other pet owners. Option C. Schedule a comprehensive veterinary examination to assess the dog's skeletal health and discuss the observed changes. Option D. Increase the dog's daily exercise to help strengthen its bones and muscles, assuming the stiffness is due to inactivity. The correct answer is C. Schedule a comprehensive veterinary examination to assess the dog's skeletal health and discuss the observed changes. Explanation. The assessment process reveals a common challenge faced by animal care providers, interpreting subtle signs of discomfort or injury in animals under their care. This scenario is professionally challenging because it requires the provider to move beyond basic observation and apply their knowledge of animal anatomy and physiology to diagnose potential issues. Misinterpreting these signs can lead to delayed treatment, increased suffering for the animal, and potential regulatory noncompliance if standards of care are not met. Careful judgment is required to differentiate between normal behavior and indicators of underlying skeletal problems. The correct approach represents best professional practice because it prioritizes the animal's welfare by seeking expert veterinary advice when faced with uncertainty. This aligns with the ethical obligation of animal care providers to ensure the health and well-being of the animals entrusted to them. Regulatory frameworks for animal care typically mandate that providers recognize signs of distress and seek appropriate veterinary intervention. This proactive stance prevents potential harm and ensures that any skeletal issues are addressed promptly and effectively by qualified professionals. An incorrect approach that involves ignoring the subtle signs of discomfort is ethically unacceptable because it constitutes a failure to provide adequate care. This directly violates the duty of care owed to the animal and could lead to the exacerbation of a condition, causing unnecessary pain and suffering. From a regulatory standpoint, this inaction could be viewed as negligence, potentially resulting in penalties or sanctions under animal welfare laws. Another incorrect approach, such as attempting to self-diagnose and treat a potential skeletal issue without veterinary consultation, is professionally unsound and ethically problematic. While well-intentioned, it demonstrates a lack of understanding of the limitations of a non-veterinarian's diagnostic capabilities. This can lead to misdiagnosis, inappropriate treatment, and further injury to the animal. Ethically, it bypasses the expertise of a veterinarian, who is the only qualified individual to diagnose and treat medical conditions. Regulatory frameworks emphasize the importance of veterinary oversight for medical issues. A further incorrect approach, such as attributing the animal's discomfort solely to age or normal activity without further investigation, is a failure of due diligence. While age and activity can contribute to discomfort, they do not preclude the possibility of a more serious skeletal issue. This approach risks overlooking a treatable condition, leading to chronic pain and reduced quality of life for the animal. It demonstrates a lack of thoroughness in assessing the animal's health and may fall short of the expected standards of care under animal welfare regulations. The professional reasoning process for similar situations should involve a systematic approach. 1. Observe and document all signs of discomfort or unusual behavior. 2. Consult available resources and knowledge regarding the animal's species and normal behavior. 3. If uncertainty remains or signs suggest a potential medical issue, prioritize immediate consultation with a qualified veterinarian. 4. Follow veterinary recommendations diligently. This process ensures that animal welfare is paramount and that all actions are taken within the scope of professional competence and regulatory requirements. Question 12. Market research demonstrates a growing trend in pet owners seeking natural or raw diets for their animals, often based on online testimonials and anecdotal success stories. A client approaches you, the certified animal care provider, requesting that their adult dog, a Labrador retriever with no known health issues, be fed exclusively a homemade raw diet that they have researched online. The client believes this diet will lead to a shinier coat and improved digestion, and they are concerned about the cost of commercially prepared premium foods. Based on your understanding of the animal care provider certification regulatory framework and best practices for animal nutrition, what is the most appropriate course of action? Option A. Immediately agree to the client's request to feed the homemade raw diet, as the client is the owner and has the right to choose their pet's food, and the online research suggests potential benefits. Option B. Suggest the client continue with their current premium commercial food, and explain that online testimonials about raw diets are unreliable, and that the cost savings are not worth the potential health risks. Option C. Advise the client that, while homemade raw diets can be popular, it is crucial to consult with a veterinarian to ensure the diet is nutritionally complete and balanced for the specific dog's life stage and health status, and to discuss potential risks such as bacterial contamination and nutritional deficiencies. Option D. Inform the client that homemade raw diets are generally not recommended due to the risk of bacterial contamination, and that they should stick to commercially available kibble, as this is the safest and most cost-effective option. The correct answer is C. Advise the client that, while homemade raw diets can be popular, it is crucial to consult with a veterinarian to ensure the diet is nutritionally complete and balanced for the specific dog's life stage and health status, and to discuss potential risks such as bacterial contamination and nutritional deficiencies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to balance client expectations and perceived cost savings with the scientifically established nutritional needs of a specific animal. Clients may be influenced by anecdotal evidence or marketing claims for alternative diets, potentially leading them to request or implement feeding regimens that could be detrimental to their pet's health. The provider must navigate this by prioritizing animal welfare and evidence-based practice over client preferences that conflict with established nutritional science. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the animal's health and well-being, which is the fundamental ethical and regulatory obligation of an animal care provider. Adhering to scientifically validated nutritional guidelines ensures the animal receives the necessary nutrients for optimal health, growth, and disease prevention. This approach aligns with the principles of responsible animal care, which are implicitly or explicitly mandated by the Animal Care Provider Certification Framework, emphasizing the provider's duty to act in the animal's best interest. It also demonstrates professional integrity by relying on evidence-based recommendations rather than unsubstantiated claims. Incorrect approaches analysis. Implementing a diet based solely on client preference or anecdotal evidence, without veterinary consultation or consideration of established nutritional science, represents a significant regulatory and ethical failure. This approach disregards the provider's duty of care and could lead to malnutrition, deficiencies, or other health problems for the animal, violating the core principles of animal welfare. It also demonstrates a lack of professional competence by failing to consult reliable sources or qualified professionals, like a veterinarian, when making critical decisions about an animal's diet. Failing to educate the client about the potential risks and benefits of different dietary approaches, and instead simply agreeing to the client's request, is also professionally unacceptable. This inaction constitutes a failure to provide informed guidance and to advocate for the animal's health. It allows a potentially harmful situation to proceed without intervention or proper consideration. Professional reasoning. Professionals in animal care should adopt a decision-making process that begins with understanding the animal's species-specific nutritional requirements. This involves consulting reputable veterinary nutrition resources. When in doubt or when faced with unusual requests, consulting with a veterinarian. Client education is paramount. Providers should explain the scientific basis for recommended diets and clearly articulate the potential risks associated with non-standard or unproven dietary regimens. If a client insists on a particular diet, the The provider should document the discussion, the client's informed consent, and strongly recommend veterinary oversight. The ultimate decision must always be guided by what is demonstrably best for the animal's health and welfare, within the scope of the provider's professional responsibilities and regulatory obligations. Question 13. The risk matrix shows a moderate risk of dehydration for a dog housed in an outdoor kennel during a heat wave, with the primary mitigation strategy being regular water provision. You are scheduled to clean the kennels, a task that will take approximately 30 minutes. The dog is panting heavily and appears lethargic. What is the most appropriate immediate action? Option A. Provide a small amount of water to the dog and then proceed with kennel cleaning. Option B. Assess the dog's hydration level by checking its gums and then decide whether to clean the kennels first or provide water. Option C. Proceed with cleaning the kennels as scheduled, ensuring water is provided immediately after the task is completed. Option D. Immediately provide fresh, cool water to the dog before commencing kennel cleaning. The correct answer is D. Immediately provide fresh, cool water to the dog before commencing kennel cleaning. Explanation. This scenario presents a professional challenge because it requires balancing immediate operational needs with long-term animal welfare, a core tenet of the Animal Care Provider Certification Framework. The provider must interpret and apply the established animal welfare standards, which are designed to prevent suffering and promote well-being, even when faced with resource constraints or time pressures. Careful judgment is required to ensure that any deviation from standard practice is justified, temporary, and does not compromise the animal's health or comfort. The correct approach represents best professional practice because it prioritizes the animal's immediate needs as dictated by the animal welfare standards. This aligns with the ethical obligation of an animal care provider to ensure the welfare of animals under their charge. Specifically, the animal welfare standards likely mandate that animals have access to adequate hydration and nutrition, and that environmental conditions are maintained to prevent distress. Addressing the immediate need for water, even if it means a slight delay in a non-urgent task, directly upholds these standards and prevents potential harm. This proactive and animal-centric approach is fundamental to responsible animal care. An incorrect approach that focuses solely on completing a scheduled task without addressing the animal's immediate need for water fails to uphold the animal welfare standards. This constitutes a regulatory failure, as it neglects a fundamental requirement for animal well-being. Ethically, it demonstrates a lack of diligence and prioritization of the animal's welfare over procedural adherence. Another incorrect approach, which involves providing a minimal amount of water without assessing the animal's actual needs or the environmental conditions, is also a failure. This approach is insufficient and could still lead to dehydration or distress, thus violating the spirit and likely the letter of the animal welfare standards. It shows a superficial understanding of welfare requirements. Professionals should use a decision-making framework that begins with identifying the animal's immediate needs, referencing the relevant animal welfare standards, assessing the severity and urgency of the need, and then determining the most appropriate course of action that minimizes risk and maximizes welfare. This involves a continuous cycle of observation, assessment, intervention, and reevaluation. Question 14. Compliance review shows that a newly acquired rabbit in a care facility is exhibiting signs of lethargy, reduced appetite, and slightly wet bedding, which could indicate a developing health issue. The provider is unsure if this warrants immediate veterinary intervention or if it can be monitored for 24 hours. What is the most appropriate course of action for the animal care provider? Adhering strictly to the Animal Welfare Act 2006, UK, and associated guidance for animal care facilities. Option A. Immediately contact a veterinarian for assessment and follow their advice, while also documenting the observed symptoms and the provider's actions. Option B. Monitor the rabbit closely for 24 hours, providing extra food and water, and only contact a veterinarian if the symptoms worsen significantly. Option C. Administer over-the-counter pain relief for small animals, as suggested by a pet supply store employee, and observe for improvement. Option D. Consult with experienced colleagues to gauge their opinion on whether veterinary attention is necessary before making a decision. The correct answer is A. Immediately contact a veterinarian for assessment and follow their advice, while also documenting the observed symptoms and the provider's actions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs of an animal with the legal obligations and ethical responsibilities of an animal care provider. The provider must interpret and apply animal welfare legislation in a practical, real-time situation, considering potential consequences for both the animal and the business. The challenge lies in discerning the most appropriate course of action when faced with a situation that may not have a perfectly clear-cut, predefined solution within the regulatory framework. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the animal's immediate welfare and adhering to the spirit and letter of animal welfare legislation. This involves taking prompt, appropriate action to alleviate suffering, and then documenting the situation and the steps taken. This aligns with the core principles of animal welfare laws, which mandate that care providers prevent unnecessary suffering and ensure animals are treated humanely. Proactive communication with the relevant authorities, as required by some regulations, further solidifies compliance and demonstrates a commitment to responsible animal care. Incorrect approaches analysis. One incorrect approach involves ignoring the situation or delaying action due to uncertainty or a desire to avoid potential complications. This is a direct violation of animal welfare legislation, which places a positive duty of care on providers to act when an animal is suffering or at risk of suffering. Ethically, it represents a dereliction of duty and a failure to uphold professional standards. Another incorrect approach might be to take drastic, unverified action without consulting the relevant legislation or seeking expert advice. Motivated by a desire to help, this could lead to actions that are not legally permissible, may not be in the animal's best interest, or could even exacerbate the problem. This demonstrates a lack of understanding of the regulatory framework and a failure to follow established protocols. A third incorrect approach could be to only address the immediate symptom without considering the underlying cause or the broader legal implications. This might involve a superficial fix that does not meet the long-term welfare needs of the animal or comply with the preventative aspects of animal welfare laws. It fails to demonstrate a comprehensive understanding of the provider's responsibilities. Professional reasoning. Professionals should approach such situations by first assessing the animal's condition and the immediate risks. They should then consult the relevant animal welfare legislation and any internal policies or guidelines. If the situation is complex or requires specialized knowledge, seeking advice from a veterinarian or the appropriate regulatory body is crucial. Documentation of all observations, actions taken, and communications is paramount for accountability and legal protection. The decision-making process should always be guided by the principle of ensuring the animal's welfare while operating within the legal and ethical boundaries of their profession. Question 15. Comparative studies suggest that the assessment of animal welfare in different settings, such as research laboratories, veterinary clinics, and animal shelters, can be influenced by the primary objectives of each environment. Considering the regulatory framework for animal care providers, which approach to welfare assessment is most aligned with best professional practice? Option A. A comprehensive assessment that integrates species-specific behavioral and physiological indicators, environmental enrichment, and the quality of human-animal interactions, while acknowledging the unique context of each setting. Option B. An assessment focused primarily on the absence of overt signs of disease or injury, as this is the most direct indicator of an animal's immediate physical state. Option C. An assessment that prioritizes the economic efficiency and operational throughput of the facility, ensuring that welfare considerations do not impede productivity. Option D. An assessment that applies a standardized set of general welfare indicators across all species and settings, assuming that core welfare needs are universally expressed. The correct answer is A. A comprehensive assessment that integrates species-specific behavioral and physiological indicators, environmental enrichment, and the quality of human-animal interactions, while acknowledging the unique context of each setting. Explanation. This scenario is professionally challenging because assessing animal welfare requires a nuanced understanding of various factors and the ability to interpret subtle indicators across diverse settings. Animal care providers must balance the needs of the animals with the practical constraints and objectives of each environment, whether it be a research facility, a boarding kennel, or a wildlife rehabilitation center. The challenge lies in applying consistent welfare standards while acknowledging that specific needs and assessment methods may vary. Careful judgment is required to avoid anthropomorphism and to base assessments on scientifically validated indicators. The correct approach represents best professional practice because it prioritizes a multifaceted evaluation of welfare, incorporating both objective measures and subjective observations, tailored to the specific species and setting. This aligns with the ethical obligations of animal care providers to ensure animals are free from pain, suffering, and distress, and have the opportunity to express natural behaviors. Regulatory frameworks, such as those governing animal research or care standards for commercial establishments, often mandate such comprehensive assessments. Ethical guidelines emphasize a proactive approach to welfare, moving beyond mere absence of disease to promoting positive experiences. An incorrect approach that relies solely on the absence of overt signs of distress is professionally unacceptable. This fails to meet regulatory requirements that often mandate proactive welfare monitoring and the identification of subtle indicators of suffering or poor welfare. Ethically, it represents a passive approach that could allow welfare issues to escalate before being detected, causing unnecessary harm. Another incorrect approach that focuses only on the economic viability of the setting is also professionally unacceptable. Practical considerations exist. Animal welfare must remain paramount and cannot be compromised for financial gain. Regulatory bodies and ethical codes consistently place animal welfare above economic interests. An incorrect approach that uses generalized welfare indicators without considering species-specific needs is professionally unacceptable. Different species have vastly different physiological and behavioral requirements. Applying a one-size-fits-all assessment can lead to misinterpretation of behaviors and an inaccurate evaluation of welfare, potentially violating regulations that require species-appropriate care. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the species and their known welfare needs and behavioral repertoire. 2. Understand the specific setting and its operational context, including any relevant regulations or guidelines. 3. Select appropriate welfare assessment tools and indicators, considering both objective e.g., body condition score, physiological parameters, and subjective e.g., behavioral observations, human-animal interactions measures. 4. Conduct regular systematic observations and data collection. 5. Interpret the collected data in the context of the species and setting, looking for deviations from normal or expected patterns. 6. Implement interventions or adjustments to care practices as needed to improve welfare. 7. Document all assessments and interventions thoroughly. 8. Continuously review and update assessment protocols based on new scientific knowledge and experience. Question 16. Assessment of an animal's reduced capacity for sustained physical activity and tendency to tire quickly during exercise. What type of muscle and its primary function is most relevant to consider for this observed limitation? Option A, cardiac muscle, responsible for pumping blood throughout the body. Option B, smooth muscle, responsible for involuntary contractions in internal organs. Option C, skeletal muscle, responsible for voluntary movement and posture. Option D, connective tissue, providing structural support and binding other tissues. Correct answer is C, skeletal muscle, responsible for voluntary movement and posture. Explanation: scenario analysis. This scenario is professionally challenging because it requires an animal care provider to accurately assess the functional limitations of an animal based on its muscle type and function, directly impacting the animal's welfare and the provider's ability to recommend appropriate care or exercise. Misinterpreting muscle function can lead to improper training, inadequate rehabilitation, or even injury, all of which are critical failures in professional duty of care. The provider must integrate knowledge of muscle physiology with practical observation of the animal's behavior and capabilities. Correct approach analysis. The correct approach involves recognizing that skeletal muscles are primarily responsible for voluntary movement and posture. Understanding that different types of skeletal muscle fibers, e.g., slow twitch and fast twitch, have varying capacities for endurance and power is crucial. A provider who correctly identifies that an animal's difficulty with sustained activity and tendency to fatigue quickly is likely related to the characteristics of its skeletal muscles, particularly those involved in endurance, is demonstrating best professional practice. This aligns with the ethical obligation to understand an animal's physiological capabilities and limitations to ensure its well-being and prevent overexertion or injury. Regulatory frameworks for animal care. Providers emphasize providing care that meets the physiological needs of the animal, which includes understanding how its muscular system supports its activities. Incorrect approach is analysis. Attributing the animal's fatigue solely to a lack of motivation or a general laziness is an incorrect approach. This fails to consider the underlying physiological reasons for the fatigue and could lead to inappropriate pressure on the animal, potentially causing distress or injury. Ethically, it demonstrates a lack of due diligence in assessing the animal's physical condition. From a regulatory standpoint, it neglects the responsibility to understand and address an animal's physical limitations, suggesting that the issue is primarily related to cardiac muscle function. While cardiac muscle is vital for overall health, is incorrect in this context. Cardiac muscle is involuntary and responsible for pumping blood. Its dysfunction would manifest in different symptoms, such as breathing difficulties or lethargy unrelated to specific physical exertion. Focusing on cardiac muscle when the observed issue is fatigue during voluntary movement misdirects the assessment and potential interventions. This represents a failure to apply correct physiological knowledge, which is a breach of professional standards. Concluding that the problem is solely due to smooth muscle dysfunction is also incorrect. Smooth muscles are involuntary and control internal organ functions, like digestion or blood vessel constriction. They are not directly responsible for voluntary locomotion or sustained physical activity. Misattributing fatigue during exercise to smooth muscle issues demonstrates a fundamental misunderstanding of muscle physiology and its relevance to the observed symptoms, leading to potentially harmful misdiagnoses and inappropriate care plans. Professional reasoning. Professionals should approach such situations by first observing the animal's behavior and performance during various activities. This observation should then be correlated with their knowledge of animal physiology, specifically muscle types and their functions. If an animal exhibits fatigue during sustained voluntary movement, the primary focus should be on skeletal muscle capabilities. The provider should consider factors like muscle fiber types, muscle conditioning, and potential underlying skeletal issues. If the symptoms are unclear or suggest a more systemic problem, the next step should be to consult with a veterinarian. This systematic, knowledge-based approach ensures that care is tailored to the animal's specific needs and adheres to professional and regulatory standards for animal welfare. Question 17. When evaluating a canine patient exhibiting lethargy and a reduced appetite alongside a single instance of loose stool, what is the most appropriate initial risk assessment approach for an animal care provider? Option A. Monitor the animal closely for any further changes in behavior, appetite, hydration, and defecation patterns, and consult a veterinarian if symptoms persist or worsen. Option B. Focus exclusively on the loose stool as the primary indicator of a problem and disregard other observed symptoms like lethargy and reduced appetite. Option C. Assume the symptoms are a minor, temporary issue related to diet or stress and require no further action unless the animal becomes severely ill. Option D. Administer a dose of over-the-counter antidiarrheal medication intended for human use to alleviate the loose stool. The correct answer is A. Monitor the animal closely for any further changes in behavior, appetite, hydration, and defecation patterns, and consult a veterinarian if symptoms persist or worsen. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to interpret subtle physiological cues that may indicate distress or illness, necessitating a strong understanding of normal canine anatomy and physiology. The provider must differentiate between normal behaviors and those indicative of a potential health issue, such as gastrointestinal upset, which can manifest in various ways. This requires careful observation and a systematic approach to risk assessment, as misinterpretation could lead to delayed treatment or unnecessary intervention. Correct approach analysis. The correct approach involves a comprehensive assessment of the animal's overall condition, including its behavior, appetite, hydration, and the appearance and frequency of defecation. This aligns with best professional practice by prioritizing the animal's welfare and adhering to the principles of responsible animal care. Specifically, it reflects the understanding that gastrointestinal issues can present with a range of symptoms, and a holistic view is crucial for accurate diagnosis and appropriate action. This approach is supported by general animal care guidelines that emphasize thorough observation and prompt reporting of any abnormalities to a veterinarian. Incorrect approaches analysis. One incorrect approach focuses solely on the presence of diarrhea, ignoring other vital signs. This is a failure because diarrhea is only one symptom of potential gastrointestinal distress, and its severity or cause cannot be determined without considering other physiological indicators. This approach risks overlooking other concurrent issues or misdiagnosing the problem, potentially leading to inappropriate care. Another incorrect approach involves administering over-the-counter human medication without veterinary consultation. This is a significant regulatory and ethical failure. Animal care providers are not licensed to prescribe or administer medications, especially human pharmaceuticals, which can be toxic or ineffective in animals. This action directly violates the principle of acting within one's scope of practice and could cause serious harm to the animal. A third incorrect approach is to dismiss the observed changes as normal aging or minor discomfort without further investigation. This demonstrates a lack of diligence and a failure to recognize that even subtle changes in an animal's physiology can signal underlying health problems. This approach risks delaying necessary veterinary care, which can have serious consequences for the animal's prognosis and recovery. Professional reasoning. Professionals should approach such situations by first establishing a baseline of the animal's normal behavior and physiological parameters. When deviations occur, a systematic risk assessment should be performed, considering all observable signs. This involves a process of observation, data gathering, e.g., noting changes in appetite, water intake, urination, defecation, activity level, and general demeanor, and then correlating these observations with their knowledge of animal anatomy and physiology. If any signs suggest potential illness or distress, the immediate next step should be to consult with a veterinarian, who is the qualified professional for diagnosis and treatment. This decision-making framework emphasizes a proactive, evidence-based approach to animal welfare, ensuring that care is always aligned with professional standards and regulatory requirements. Question 18. Stakeholder feedback indicates that some animal care providers are struggling to differentiate between normal behavioral fluctuations and early signs of neurological distress in animals under their care. Considering the structure and function of the nervous system, which of the following approaches best demonstrates a competent and compliant response when an animal exhibits unusual tremors, lethargy, and altered vocalizations? Option A. Focus exclusively on adjusting the animal's diet and bedding, as these are the most common causes of behavioral changes. Option B. Immediately consult with a veterinarian to report the observed symptoms and discuss potential causes and next steps. Option C. Assume the animal is simply tired or experiencing a temporary mood swing and monitor it without further action. Option D. Administer a mild sedative or pain reliever that is commonly used for humans, as it might alleviate the symptoms. The correct answer is B. Immediately consult with a veterinarian to report the observed symptoms and discuss potential causes and next steps. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to interpret subtle behavioral changes in an animal and link them to potential underlying physiological issues, specifically related to the nervous system. Misinterpreting these signs could lead to delayed or incorrect treatment, causing unnecessary suffering and potentially compromising the animal's welfare. The professional must balance observational skills with knowledge of animal physiology and the regulatory framework governing animal care. Correct approach analysis. The correct approach involves recognizing that tremors, lethargy, and altered vocalizations are potential indicators of neurological dysfunction. This approach aligns with the Animal Care Provider Certification Regulatory Framework, which mandates that providers observe animals for signs of distress or illness and report any concerns promptly. Understanding the basic structure and function of the nervous system, including how damage or dysfunction can manifest in motor control tremors, energy levels, lethargy, and communication vocalizations, is crucial for accurate assessment. This proactive and informed observation represents best professional practice by prioritizing the animal's well-being and adhering to the duty of care. Incorrect approaches analysis. One incorrect approach is to dismiss the observed behaviors as simply a temporary mood change or a minor inconvenience. This fails to acknowledge the potential for underlying neurological issues and violates the regulatory requirement to monitor animal health. Ethically, it demonstrates a lack of diligence and could lead to the animal's condition worsening without intervention. Another incorrect approach is to immediately administer over-the-counter human medications without veterinary consultation. This is a significant regulatory and ethical failure. Animal care providers are not veterinarians and are prohibited from prescribing or administering medication without explicit veterinary direction. This action could be harmful to the animal due to species-specific drug sensitivities and bypasses the professional diagnostic process. A third incorrect approach is to focus solely on external environmental factors, such as temperature or diet, as the sole cause without considering internal physiological processes. While environmental factors can influence behavior, the combination of tremors and lethargy strongly suggests a more systemic issue, potentially neurological. This approach is flawed because it limits the diagnostic scope and may overlook a serious underlying condition, failing to meet the standard of comprehensive animal assessment required by the certification. Professional reasoning. Professionals should employ a systematic approach to animal assessment. This involves 1. Thorough observation of the animal's behavior, physical signs, and environment. 2. Correlating observed signs with knowledge of animal physiology and common ailments, including neurological conditions. 3. Consulting the relevant regulatory guidelines for reporting and escalation procedures. 4. Seeking professional veterinary advice when any signs of illness or distress are observed, especially those suggestive of serious conditions. This structured decision-making process ensures that animal welfare is prioritized and regulatory obligations are met. Question 19. Risk assessment procedures indicate that a multi-species housing environment is experiencing increased tension. A group of rabbits are exhibiting thumping, a ferret is showing piloerection and vocalizing, and a parrot is displaying agitated feather ruffling and increased vocalizations. As an animal care provider, what is the most appropriate initial response to de-escalate the situation and ensure the welfare of all animals? Option A. Immediately enter the enclosure to physically separate the animals, speaking in a loud, firm voice to assert dominance and re-establish order. Option B. Interpret the rabbit thumping as a sign of excitement and the ferret's piloerection as a sign of playfulness, and proceed with routine feeding without altering the current environment. Option C. Focus on the most vocal animal, the parrot, by attempting to engage it in a training exercise to distract it from its agitated state. Option D. Observe the animals from a distance, noting specific behaviors and environmental factors that may be contributing to the stress, and consider introducing calming environmental enrichment or adjusting lighting if appropriate, without direct interaction until the tension subsides. The correct answer is D. Observe the animals from a distance, noting specific behaviors and environmental factors that may be contributing to the stress, and consider introducing calming environmental enrichment or adjusting lighting if appropriate, without direct interaction until the tension subsides. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to interpret subtle behavioral cues from multiple species with differing communication styles. Misinterpreting these signals can lead to stress, injury, or a breakdown in the animal's welfare, directly contravening the core principles of responsible animal care. The provider must balance the needs of individual animals with the safety of the group and themselves, necessitating a nuanced understanding of species-specific communication. Correct approach analysis. The correct approach involves observing and interpreting a range of species-specific signals, including vocalizations, body language, and scent marking, and then responding with appropriate, non-threatening interventions. This aligns with the animal care provider certification's emphasis on understanding and responding to animal welfare needs through accurate behavioral interpretation. It demonstrates a commitment to proactive welfare management by recognizing early signs of distress or conflict and intervening before escalation. This approach is ethically sound as it prioritizes the well-being of the animals and is compliant with regulatory guidelines that mandate appropriate care and handling based on species-specific needs. Incorrect approaches analysis. One incorrect approach involves relying solely on human-like interpretations of animal behavior, such as assuming a dog's guilt expression is indicative of understanding wrongdoing. This fails to acknowledge species-specific communication and can lead to misapplied discipline or a lack of understanding of the actual cause of the behavior, violating ethical standards of accurate assessment and potentially causing undue stress. Another incorrect approach is to ignore subtle signs of discomfort or aggression in favor of more overt behaviors. This reactive approach can lead to escalation of conflict, potential injury to animals or staff, and a failure to meet the duty of care mandated by animal welfare regulations. It demonstrates a lack of observational skill and a disregard for preventative welfare measures. A third incorrect approach is to apply a single, generalized communication strategy across all species, such as using loud vocalizations to calm all animals. This ignores the vast differences in how species perceive and react to auditory stimuli, potentially causing fear and anxiety in some animals while being ineffective in others. This violates the principle of species-appropriate care and can be detrimental to animal welfare. Professional reasoning. Professionals should employ a systematic approach to observation, focusing on recognizing and interpreting species-specific communication signals. This involves continuous learning about animal behavior, consulting with experts when necessary, and maintaining detailed records of observations and interventions. When faced with ambiguous signals, the safest and most ethical course of action is to err on the side of caution, providing space, reducing stimuli, and seeking further information or assistance before proceeding with any intervention. This decision-making process prioritizes animal welfare and adherence to regulatory standards. Question 20. Upon reviewing a domestic feline recovering from a routine space surgery, you observe that it is breathing rapidly and shallowly, with its chest visibly rising and falling with each breath. The animal appears alert but is not actively grooming or seeking interaction. What is the most appropriate immediate action to take? Option A. Immediately contact the veterinarian to report the observed respiratory rate and pattern, and any other relevant clinical signs. Option B. Assume this is a normal post-anesthetic response and continue to monitor the animal from a distance. Option C. Offer the cat fresh water and ensure its bedding is clean and comfortable. Option D. Administer a mild sedative to help the cat relax and slow its breathing. The correct answer is A. Immediately contact the veterinarian to report the observed respiratory rate and pattern, and any other relevant clinical signs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal care provider to interpret subtle clinical signs indicative of a potentially serious respiratory issue in a vulnerable patient. The provider must move beyond superficial observation to understand the underlying physiological mechanisms at play and make a prompt, informed decision regarding intervention, balancing the need for timely care with the risk of unnecessary stress to the animal. Correct approach analysis. The correct approach demonstrates best professional practice by recognizing that rapid, shallow breathing in a recovering patient, especially after anesthesia, is a significant deviation from normal recovery. This observation, coupled with an understanding of the respiratory system's function, gas exchange, maintaining oxygen levels, removing carbon dioxide, suggests potential complications such as pain, pulmonary edema, or airway obstruction. Promptly notifying the veterinarian allows for a professional assessment and timely diagnosis and treatment, aligning with the ethical duty of care and the regulatory requirement to report significant changes in an animal's condition. This proactive step ensures the animal receives appropriate medical attention, preventing potential deterioration. Incorrect approaches analysis. One incorrect approach involves dismissing the rapid breathing as a normal post-anesthetic response. This fails to acknowledge that, while some changes are expected, persistent or pronounced tachypnea can signal underlying problems. Ethically, this inaction breaches the duty of care by potentially delaying critical medical intervention. Regulationally, it could be seen as a failure to monitor the animal adequately and report significant clinical changes. Another incorrect approach is to attempt to administer a sedative without veterinary consultation. This is a significant regulatory and ethical failure. Administering medication without a veterinarian's order is outside the scope of practice for most animal care providers and can have dangerous consequences, especially in a patient with compromised respiratory function. It bypasses the professional diagnostic process and could exacerbate the animal's condition. A third incorrect approach is to focus solely on providing comfort measures like fresh water and a quiet environment without addressing the underlying physiological distress. While comfort is important, it is insufficient when the animal is exhibiting signs of respiratory compromise. This approach neglects the immediate need for medical evaluation and intervention, representing a failure in professional judgment and potentially violating standards of care. Professional reasoning. Professionals should approach such situations by first observing and documenting all clinical signs meticulously. They must then apply their knowledge of animal anatomy and physiology, specifically the respiratory system, to interpret these signs. If the signs suggest a deviation from normal or a potential problem, the immediate next step is to escalate the concern to the supervising veterinarian. This systematic process ensures that the animal's welfare is prioritized through appropriate medical oversight and intervention, adhering to both ethical obligations and regulatory frameworks governing animal care.